Hello everyone. In this session, we are going to discuss two important topics, that is benign prostatic hyperplasia and prostate carcinoma. On both of them, you usually get a long question in your university exam, but sometimes you can get a short question on individual portion of each of them. So basically, we will be discussing the etiopathogenesis, gross and microscopy and grading, staging and spread of each of them. So first we will see the details of benign prostatic hyperplasia and then we will come on prostate carcinoma. Before understanding the two topics in detail, that is BPH and prostate carcinoma, you must understand the normal prostate anatomy and histology, without which you cannot understand these two topics. So first I will let you know the normal prostate anatomy and normal prostate histology. Then we will start the benign prostatic hyperplasia and I will let you know its introduction, most common site, etiology, gross and microscopy. Then we will come on the prostatic carcinoma and we will see the prostatic carcinoma under the same headings, that is introduction, site, gross, microscopy, spread, tumor markers and grading. Now this is the benign, as the name indicate, benign malignancy of the prostate, and this one is the malignant, as the name indicate, this one is the malignant tumor of the prostate. So we are basically studying the two type of tumors of the prostate, the benign tumor of the prostate and the malignant tumor of the prostate. Since the prostatic carcinoma is the malignant one, so we will see its spread, tumor markers and grading also, along with the gross and microscopy. So let's start the topic one by one. First, let me tell you the normal prostate anatomy. So what is prostate? Prostate is a gland which is present only in males, not in females. It is a very small gland, nearly 20 gram in weight, and it is present at the commencement of the male urethra. Can you see, this is the urinary bladder of a male and this is the urethra of a male. Whereas the prostate is a spherical gland. The prostate is the spherical gland from which the urethra is passing. So in the prostate, there is a defect. The urethral orifice is there, and from that orifice, the urethra is passing. It's a spherical gland which is present at the commencement of the male urethra. You can see this is male urethra, and at the commencement of the male urethra, this prostate gland is present. And here you can see the other view also. This is the prostate gland. Here the urethra is, and the urethra is there, and this is the penis of a male. You can see the lateral view. So you can see the anterior view, you can see the lateral view. This is the prostate gland. Now in the prostate, you have to understand there are 5 lobes and 3 zones. So let me explain you what do you mean by 5 lobes, and let me explain you what do you mean by 3 zones in the prostate, and let me combine the two. Then you can understand the anatomy more importantly. So let's start with the 5 lobes of the prostate. What are the 5 lobes of the prostate? Now if you see the transverse section, if we are cutting the prostate from here, can you see this is the prostate gland? If we are cutting it from here and looking from above, so if we are cutting the gland from here and looking from above, that is the transverse section. So what you can see? You can see this is the urethra. Let me show you. This is the urethra at the center. So this is the urethral orifice from which the urethra is passing. Can you see? Now this is the anterior lobe. Can you see the pink color? This is the posterior lobe. This is the middle lobe. From the middle lobe, this urethra is passing. The urethral orifice is there. So one anterior lobe, one posterior lobe, one middle lobe, and 2 lateral lobes are there. Can you see these two? These 2 are lateral lobes. So total 5 lobes are there. Can you enumerate the 5 lobes? You can see one is anterior. Here you can see. You can see one is middle. Here you can see one is posterior. Here you can see, and 2 are lateral. You can see the 2 lateral, the right lateral and the left lateral. Total 5 lobes are there. This is the transverse section. So we are cutting the prostate gland from here and looking from above. Now if you see at the sagittal section, you can see same the 5 lobes. Here also you can see this one is complete urethra. Appreciate the urethra. This is the green color urethra. The color scheme is same. So this one is the urethra you can see, and you can see where is the anterior lobe. The anterior lobe is shown by the pink color. So this one is anterior. You can see it is anteriorly. This one is posterior. This one is posteriorly. And you can see that this one is middle. This one is middle. So you can see one anterior, one posterior, one middle. The lateral lobes are not visible in this diagram. The 2 lateral lobes are not visible in sagittal section. So I hope you got it. So you can understand there are 5 lobes in the prostate. So the middle lobe is there. First I will try to draw the middle lobe. In the middle lobe, this is the urethral orifice you can see. This is the anterior lobe. This is the posterior lobe, and there are 2 lateral lobes. Let me draw the 2 lateral. So these are the 2 lateral, the right lateral and the left lateral lobes. So these are the 5 lobes. So anterior, posterior, middle, lateral, the 5 lobes of the prostate. I hope you all got it.